The impact of cannabis use on the drug treatment court programs in Ontario. Does cannabis use help or hinder a participant's completion of a drug treatment court program? This project explored participants' experiences and service provider perceptions of cannabis use and the resulting impact on how clients are supported. The project was led by the Canadian Mental Health Association and the John Howard Society of Ontario, with support from many other supportive individuals and organizations in Ontario. Dr. Akwasi Owusu-Bempa.
Drug treatment courts are intended to take people whose criminal behavior, criminality, is linked to or perhaps caused by their substance use or misuse or addictions problems, and take a more therapeutic approach to dealing with them as opposed to our traditional criminal justice model. One of the goals of the project is to understand how cannabis use, and especially with legalization having come about, influences people who are going through drug treatment courts, how it impacts their experiences in either a positive or a negative way.
Camille Quinville.
Well, we know, of course, that academic research is critical to building evidence and informing good public policy, but so is community-based research, and you really need both to do well. So my colleagues around the province, whom I'm immensely proud of, do this work every single day. They listen to the voices of those with lived experience, and that is so critically important to informing the very best evidence.
Megan Costa.
Typically, it's the researchers who kind of, they come in and they're like, yeah, we're going to research this population we don't know much about. We know there's literature, we know this, but then they never involve the actual people who are being impacted by it. Or, a lot of the times it's the stakeholders that are getting asked questions and not individuals who have lived experience, which I think is a huge difference in research. Even asking questions in a certain way, being like, well, that's not through a lens that's trauma informed, or that's someone doesn't want to be asked a question in that way. Here's a better way of phrasing it. That really helps for a researcher.
Nicoletta Curson.
Drug treatment courts program are a combination of the criminal justice system team and a treatment team that come together to try to treat participants who commit crimes because of their substance use disorder or addiction. And so they hope to support them in numerous ways, including housing, employment, education, attaining their own personal and life goals, mental health treatment. Of course, substance use treatment is a major component of the program. And finally, to decrease cycling back through the criminal justice system repeatedly.
Individuals are invited to participate in the first survey. So the first survey was really setting the groundwork. It was like demographic information, criminal justice involvement, their mental health, their cannabis use, general substance use, anything like that. And then every 3 months, we'd ask them to come back and participate in a follow-up survey. And that would see their change over time. So it's like, in the past 3 months, have you done this? Has this changed? Like, how much cannabis have you consumed? And how has this impacted your mental health? So we actually ended up with 22 participants after the entire year was done, who had completed the entire process. Our research findings right now are very preliminary, but in some circumstances, cannabis has been shown to be beneficial for clients, whether that's through their progress in the program, on their mental health, and even our clients have, through our surveys, they've mentioned that it actually can be beneficial to them. Whether that's their mental health, whether that's their completing the program, it helps them along the way, and it is a harm reduction tool.
There's a lot of stigma around people who have experience with the criminal justice system, people who have substance use disorder. I really think that this research will help people see that nobody is set in stone. People have their set of experiences. They have taken certain actions that have led them to this place, but everything can always change with the right support.
Personally, I really look forward to the day when community-based research is informing the very best public policy.
A community-based research project by the Canadian Mental Health Association of Ontario, the John Howard Society of Ontario, and the Human Services and Justice Coordinating Committee. Mental Health Commission of Canada. mentalhealthcommission.ca. The views represented herein represent solely the views of the research team. Production of this material was made possible through the MHCC's cannabis and mental health research initiatives and a financial contribution from Health Canada.